Sergio and I represent a design and innovation firm called Frog. And Frog is one of those consulting firms that does work with a lot of the usual suspects in Silicon Valley and beyond in shaping products and services of the future, digital and physical and branding strategies and solutions for, in this case, the developed world. But in the last decade, we have started to really kind of ask ourselves, is there a way that we could maybe take the same methodologies and approaches that kind of lead to innovate in the high-tech space and in the private sector space and apply them to the humanitarian development context, and have increasingly engaged with this world, with you, with organizations like the ones that are represented today, to really develop different solutions and strategies that address, for example, newborns, where there's hardly any support system, or using mobile technologies together with organizations like Unicef and others to bring back HIV test results back to community health workers and to, of course, families and individuals, as fast as possible. And I just wanted to briefly touch upon, the type of programs that in the last 2-3 years we've actually found ourselves kind of working with and in. So, for example, with the GSM Foundation, we have been trying to help them understand how to channel UK aid funding to instigate commercial actors in the mobile ecosystem, essentially mobile network operators in 6 countries across Asia and Africa, to look at probably an underserved group of end users, smallholder farmers, so that somebody would become interested in essentially providing services that are meant to really make their life easier, but at the end to make them more successful commercially. And at the end, this was essentially money that was channeled to make a private sector organization more successful in many ways, but by pointing them, by having them focus in a direction that they wouldn't necessarily focus on otherwise. In a slightly different but similar way, we've been working, for example, with the G Foundation. They donated oxygen plants to 2 rural hospitals in Rwanda and in Kenya, but quickly realized that that investment would not necessarily pay off unless somebody thought about what would happen after they essentially step out of the picture. And so what we have ended up doing with a fairly large number of other partners is trying to understand, could we create a local business that is going to sell the exact oxygen from these plants as a way to then maintain the plants themselves. So self-sustaining circle, if you will, in which public donations or a philanthropic effort drives, if you will, a for-profit effort. And then there are projects like the Wearables for Good competition, which is a global challenge that we launched last year with the Unicef Innovation Unit, again represented here during this event, where we essentially try to open up to the large public and around the world to ask, could we actually use wearable technology to do something more than just tracking somebody's calorie loss or how many steps they take, and actually try to answer real needs where it's the most needed. And if you start to kind of see some patterns in here, I think they do speak to the changing role of humanitarian organizations in the way that we have been working with them. And the analogy that I usually like is, comes from healthcare. I do a lot of work also on the corporate side with healthcare service providers across the entire spectrum. And in the same way that we heard from Ryan at the beginning, this is a huge problem, and costs are mounting. And quite honestly, we don't know how to face those mounting costs. This is an unsustainable solution. The same thing, as has been happening also in the healthcare space, where we're essentially kind of sitting on a broken system. And at one point, somebody has started to say, we need to move away from providing solutions when people start to be in need because they have cancer or because they have a problem to be solved. And then the machine kind of shifts gears and kind of kicks into place. We have to start looking at prevention. We have to start moving upstream to create essentially opportunities for communities to be more resilient, to be better prepared. And so it's kind of, this is language that's more maybe healthcare language. You would probably talk about a shift from aid or providing fast aid to actually providing better preparedness. And so last example of this type of work comes from a collaboration, again, with good friends and partners at the Red Cross that we've been running in the last 6 months, where we started from exactly that question. Could we look at a problem, fire in informal settlements, and could we actually use technology to make those communities more prepared so that once a fire arises, we can use technology to augment what they're already doing to address the problem. And it did speak to, as the last speaker also said, to a different way of engaging, I think, with the problem, which doesn't necessarily start from the, if you will, programmatic approach of here's, some funding that we can use to try and eradicate this problem by, using an intervention or trying to run a pilot. It was more like, let's see bottom up what these communities need. Let's try to understand what kind of role they want to play. Let's activate them so that they will co-design with us, essentially, the solution. And I think this speaks to what we as a design, again, firm, but I think the design community can really bring to you as a humanitarian community to say, I think in our lingo, in our jargon, we talk about human-centered design or user-centered design or design thinking really as a way and as a well-assessed and at this point proven methodology to reveal solutions bottom up and to shine the light back onto the beneficiaries at the end of the solutions, rather than taking the point of view of the funders and the UN agencies and the NGOs that are essentially trying to kind of do their job in improving the lives of their beneficiaries. I think it does speak also, in general, to a change in roles and potentially also to a change of mentality. I was asked also to bring a little bit of that, like what could the private sector, what could businesses do? And it was really interesting to hear the second speaker, I apologize, I'm blanking on the name, to say, where's the business case, which is exactly where the business community will start from. But I think there is, and maybe that's the optimist in me, I think there is real potential, as we've seen during the Red Cross program that I was talking about, to position humanitarian organizations as that missing link between the needs that are clearly voiced by communities and also the aspirations of the communities that humanitarian organizations are trying to address, but then to be an amplifier of those needs towards the business community and vice versa, creating channels, creating opportunities for the definition of areas where shared value can be generated, and especially with a focus on local growth, on local economic growth as part of humanitarian interventions. Wrapping, if you will, all of this around, again, the idea that it would be a shift from providing fast aid and becoming ever more efficient at using resources to provide first response to disaster and aid, to actually making sure that those communities are better prepared to face those disasters. Not if, but when they will happen. And so it's a change in roles because it, I think, points to the humanitarian organization world as a space where you could start to see yourselves as conveners of different partners and also instigators. Again, shining the light where businesses might not see opportunities and actually saying there is an opportunity there, there is an opportunity for you to play a role, make a difference, but also make a profit. And I'll end it there. Thank you.